So speaking of the peroneus, now we're talking about the lateral compartment. So those are going to be, primarily these two muscles here are going to be the fibularis or peroneus longus and fibularis or peroneus brevis. Okay? So then this fibularis, obviously they're going to be coming off of the fibula. It's going to be the head and upper lateral surface of the fibula. And then the longer one is going to go and wrap underneath the foot and come all the way across to the medial side. So there just so happens to be this little convenient groove where it can come underneath here and come across to the other side of the foot. Okay? And when we get into doing palpation and stuff on the muscles, we'll be able to identify those. Okay? And then you have the fibularis or the peroneus brevis. That's going to come off a little bit more distal. So that's going to be the distal 2/3 of the lateral fib. And then it's going to go right into this tip here, the base of the fifth nib. Okay? So the other one comes in and wraps around to the other side, and then the other fibularis brevis is going to attach right here. So we get into palpation and examining of the foot and lower leg, you can see that. Okay, so there's the two muscles of the lateral compartment. So then that leaves us with the posterior compartment. And then the posterior compartment, that's where you have a superficial and a deep portion. So these are going to be flexors of the feet and the toes. First flexion of the ankle. Or no, plantar flexion. So you have the triceps surae, which is the name for three muscles together. And that's the gastrocnemius and the soleus are the two parts of that. And then you have this little plantaris muscle. So those three things form this triceps surae. And then this is a situation where those muscles are all combining to form one strong tendon. Okay? And that's going to be the Achilles tendon down here. Okay? And the gastroc is the two-joint flexor. It crosses two joints and it flexes at both of them. So it crosses the knee joint, it does flexion of the knee, crosses the ankle joint, and does flexion of the ankle or plantar flexion. And then the soleus is only going to be a one-joint flexion. And that's going to be deeper. And then this deep layer is going to be the popliteus, and that's the one that only crosses up at the knee. Then you're going to have, similar to what we had in the anterior leg, and then also kind of similar to what we had in the forearm, you can have deeper ones that are going to go to the toes, the last couple, 2 to 5 toes, and then another one separate for the big toe. That's going to be flexor hallucis longus and flexor digitorum longus. And then also we're going to have tibialis posterior. So here's the gastrocnemius. Again, that's going to come off of the femur because it's a two-joint flexor.
There's a question here in the notes that says the origin is via the two heads from the medial and lateral femoral condyles, and then it says posterior joint capsule, and it's got a question mark.
I think it's just because I was adding some other. Yeah, it's like some sources said that they mentioned that it attaches to the posterior joint capsule, and some don't. It's like I said, there's stuff that they put in the notes that if it goes beyond the mainstream things that you need to know for most purposes, yeah, those special kind of brackets. That means this is what you may see in some sources, but you don't necessarily have to memorize that, or you don't have to study it for this class. It's just extra information. So then again, it's going to go into the calcaneus by way of that common tendon, the Achilles tendon. And then, of course, it's going to do knee flexion and plantar flexion or flexion of the foot. Then you have the soleus, which you can see that's not crossing the knee. So it's going to come from the tibia and the fibula and then the tendinous arch that goes in between. And the reason why it's a tendinous arch is that there's still a lot of structures that need to go past that, the arteries and veins and nerves. So there has to be an opening in there for those structures to get through. And then it's going to be plantar flexion of the foot. And then also, there are certain muscles that are involved in your posture that you're not necessarily actively contracting. And so the soleus is one of them. Obviously, it's keeping you from falling over, right? So it's contracting to kind of pull you back, hold your body up. So it's a postural muscle. So then there's the superficial muscles. You have the gastrocs taken away, and then here we have the soleus. And then these are the ones we'll talk about next, which are going to be the deep muscles. So we just have these last couple muscles here. We'll talk about those, then we'll take a break, and then we'll go over all that stuff again by way of doing muscle testing and palpation. So we're going to be taking out the tables and doing palpation. So there's a mnemonic that you talk about with this posterior, the deep muscles of the posterior compartment. So it's Tom. The simplest way is just Tom, Dick, and Harry, but another way is you put the Van in between. So it's Tom, Dick, Van, Harry. So it's going to be tibialis posterior, there's the T for Tom, flexor digitorum longus, and then you have the vein, artery, and nerve, and then you have flexor valgus longus. So those are what's going to go through this area here, and it's what you call the tarsal tunnel, which is right here. I can't lift my leg up. But if this was the foot, it's like right here. It's like we talked about in the hand, you have the carpal tunnel. So the counterpart of that in the foot's going to be the tarsal tunnel. So that's going to be right here. And tibialis posterior is the muscle that inserts into just about every bone of the foot. And we'll talk first about the popliteus. Okay, so the popliteus is up here, and it comes off of the lateral condyle of the femur up here, and then it's going to insert into the tibia here, the proximal tibia. So what it's going to do, it's going to do a little bit of flexion at the knee, and then also internal rotation of the knee, but only while the knee is flexed. So it pulls back up here. So we talked about when you have the screw home or the locking home mechanism of the knee, as the knee extends all the way, it externally rotates a little bit, and that kind of locks the knee. So to unlock it, as it's starting to flex, that popliteus is going to externally rotate. So then, now we're talking about tibialis posterior. So that's going to come off of, okay. So here, it's coming off of the superior tibia, and then the fibula, and then off also the interosseous membrane. So like I say, whenever you get into these deeper muscles, the gastroc comes up higher, and then this is going to be deeper, so it's going to be closer to that interosseous membrane, so it's going to come off of that membrane and the two bones of the lower leg, tibia and the fibula. And then it's going to insert onto the plantar surface of all the cuneiforms, the cuboid, the bases of the second and fourth metatarsal, and the sustentectum tali, which is part of the talus. I think that comes up as one of the landmarks that we'll get into when we do the foot.